Hello, everybody, and welcome to this month's Google Hangout. I have two guests with me today. One is Amy Moore, our technology coordinator, and I have Keri Baker, who is the executive director and co-founder of Sacred Valley Health. Hi, Keri.
Hi, how are you?
Welcome. Keri, can you share some details of your project with us?
I would love to. Let me go ahead and pull up my presentation. So, as mentioned, I'm Keri Baker, and I am the executive director and co-founder of Sacred Valley Health. We are an organization that was launched in 2012. We work in Ollantaytambo, Peru, which is in the Sacred Valley. In Peru, we are known as Aini Wasi, which means House of Reciprocity in Quechua. We live and work in an area where the primary languages are Spanish and Quechua. So our mission of our organization is to promote health in the underserved communities of the Sacred Valley. We've built our organization on the three pillars of education, access, and empowerment. The demographic and the geography of our region in which we work, there are approximately 10,000 people living in our catchment area, which means there's probably about 32 communities. All of our communities live at 10,000 feet or higher above elevation. Our primary industries are farming, tourism, and textiles, and we tend to work with individuals who are either of low literacy level or illiterate. The average income for our families is approximately $30 a month. So our programs within our organization there are three of them. There is our Promotora program, our Docente program, and our university partnerships. Our topics we are focused on health education, and our topics range from respiratory and diarrheal illness, women's health, malnutrition and anemia, preventative health, first aid, and leadership and public speaking. So our Promotora program is how our organization initially started. We started with 13 women in which we trained them to become community health workers. The idea being is we work with communities select several people within their community to become an educator. And so we train someone who will then go on and train her neighbor. We initially started working with men and women. However, we are primarily now only training women. The Promotora program is broken down into three levels. There's the basic level, the intermediate, and the advanced. So the basic level is when the community elects an individual. We then train them in very basic skills for the first year. Then after their first year, they move on to intermediate, in which it becomes more in-depth training. And then once they pass specific metrics, they become advanced, which allows for them to specialize in different topics. As I mentioned, we work in 14 high altitude communities, of which 41 of our 44 promotoras are women. This is an example of some of the curriculum we used. As I mentioned, most of these women are low literacy or illiterate. So everything we do is based in pictures, hands-on education, in addition to using PowerPoints or community visits as education tools. Here's an example of some of our women. You can see that we teach really basic dental care. We teach women's health, reproductive health, and then we even teach things as simple as the Heimlich maneuver and first aid skills. So the next program that we have is our Docente program. So after training our promotoras for several years, we realized that we were relying too much on foreign staff. So we looked at creating a train the trainer program. We took several individuals from our Promotora program who were excelling, and we trained them to become trainers. The idea being, if we can train people on the most outlying areas that we are working, they can then reach communities that we are unable to access. This increases access and sustainability. It empowers these promotoras as they then they come onto our payroll and they start earning a monthly income, which is pretty uncommon for a lot of these women. And then it also has improved our staff outcomes, as we are now more than 50% Peruvian staff. Here's an example of one of our promotoras, one of our docentes. She was initially one of our first class of promotoras, and she's now leading a PowerPoint on training about diarrheal illness. So the third part of our program is our university partnerships. So this started out initially as a way to help fund our program. We're partnered with multiple universities within the US. We tend to partner more with nursing schools and public health schools. And then what we do is we train our promotoras now to become educators. So these groups come down, and these groups of women, our promotoras, will then train these visiting nursing students in things such as wilderness medicine, different sort of preventative health education. The idea that we're kind of flipping the paradigm, rather than groups coming down to save Peru, It's demonstrating to these groups of students that these countries and these programs have something to offer them. And this university partnership usually provides approximately 30% of our annual funding. So now this is where Dining for Women comes into play. So our grant that we applied for, which we are extremely grateful that you are sponsoring us, is regarding anemia and malnutrition. So the problem that we've had is that 54% of the children within our communities are either stunted or underweight by the World Health Organization, and 55% of children under 5 are anemic. And this was a problem that was not only identified through our data gathering, but a lot of our women brought this to our attention as they're looking to improve the health outcomes of their children. So the solution, so this is our program. It's what we look at doing is we're going to train 5 advanced promotoras to become trainers of nutrition. This will be year 1. With the expectation it's more of the train the trainer model that they will then in turn train 15 more promotoras. These women together will go out and they will do house visits, specifically targeting specialized nutrition education, and that we in turn will be able to pay them for working with us. So not only are we improving health outcomes, we're also providing them economic opportunity. In year 2, we'll select 3 more women of those groups of 15 promotoras. 3 of them will also be employed, who will become advanced nutrition specialists with the idea that they will train 15 more promotoras. So again, this is providing pretty significant economic opportunities to women who might not normally have that. It's improving health outcomes, and hopefully these are our goals of the outcome we hope to see. We've hired 8 advanced nutrition docentes over the course of 2 years. We'll train them not only in leadership skills, adult learning, and advanced nutrition education. We will train and certify 30 advanced nutrition community health workers over the course of a 2-year grant cycle. We're going to increase community member knowledge, and then we're increasing awareness about existing nutritional practices. And ideally, long-term, what we're shooting for is to decrease the number of children under 5 who are underweight, stunted, and or anemic. And we also hope to provide more economic opportunity to women that are within our organization. So at this point, if you have some questions, I am all ready for it.
Thank you, Keri. Thank you so much for that presentation. Welcome back.
Thank you. Thank you.
My first question to you is, can you give us some idea of the geography for those Dining for Women members who have not yet watched their video? Their video is breathtaking in capturing the beauty of the geography of this area. Keri, since you talked about anemia too, can you reference how much meat there is in the diet?
Those are great questions. So as I mentioned in the presentation, all our communities are usually at 10,000 to 12,000 feet above sea level. So if you can imagine, hold your breath and you'll feel what it feels like. It's a pretty isolated environment. Most of our communities lack access to healthcare. So for example, if you are trying to get to the local clinic, you could plan on walking anywhere from 2 to 4 to 6 hours just to access a healthcare provider. So not only is there limited road access, there's limited access to healthcare and education. So we really target the most outlying communities that do not have access to these resources. So it's definitely an area that's a bit isolated. It's beautiful, but it's very isolated. And then in terms of, in terms of the anemic rates, or it was meat in their diet. So most of the time the diet consists of potatoes, and they will have limited access to meat depending on how much money the family has. A lot of times you'll see them eating fish from the local streams. They might eat some llama is another one, and then also some sheep. So.
Okay. Can you give us some kind of an idea of what these families are like, how large they are demographically?
So a lot depends on the family. I would say that majority of them are actually very large. So a lot of our promotoras have kids anywhere from 2 to upwards of 6 or 7. I think the more remote you go, the tendency is that they will have more. We specifically target women's health education because a lot of times there's that theory the men have that if their wife is pregnant, their wife is not cheating on them. So they will continually have more and more babies. So you can see some very large families, and you can also see families where some of the parents are living with them as well.
Okay, so they're multi-generational. So in your project, you were talking about how you would be educating the mothers of these little children on how they can diversify the diet. Can you expand on that?
Yeah, so our goal, our intervention with this is that our education is going to be extremely focused on nutrition. So not only are we talking about like complementary feedings, we're encouraging mothers to continue breastfeeding up to the 1 year mark, as we see that a lot of them will stop breastfeeding earlier. We're also partnering with an organization called Andean Alliance, who looks at farming practices in the region that we're working in to see if we can help them diversify their diet that way as well. As most of these individuals only have access to potatoes and maybe some basic meat, some milk, what they can do to diversify their diet, not just me telling them or us educating them in the sense, you need to eat fruit, you need to eat more vegetables. If you don't have the money to grow it or buy it, like what can we do to do that? So working with a different organization that can emphasize farming practices and really help guide diversifying in diet. We're going to look at targeting those at complementary feeding, and then also what does nutrition look like? What does good nutrition look like?
Mm-hmm. So these promotoras, who are basically community health workers, you have seen tangible results of their efforts, correct?
Yes. Yeah. Our program's been going for about 5 years right now. And not only are we seeing that in terms of improved health outcomes, we're also seeing it a bit from the community feedback. We have communities now that are specifically coming to our organization asking for our program to come in there. And then,
sorry.
No, that's okay. And then we're also seeing it in terms of improved outcomes with our women in the sense that their knowledge base, reproductive outcomes are improving. Just even we do pre-tests and post-tests. We visit communities, and just as a whole, the communities are growing in knowledge.
So in the time we have left, can you tell us what are some of your challenges in running your projects?
Every day. So we have a project that we not only are going from English to Spanish to Quechua, so we have multiple languages that we look at. So it's like a really good game of telephone. But also, of course, we have individuals with a lower literacy level up to a more advanced literacy level. So our education must be provided not only in hands-on, it has to be provided both by drawing, it has to be provided by role play. So that can make things a little bit more difficult. We also found simple things that like you wouldn't expect, but training women from one community to become a docente and having them train others in a different community can cause some cultural shifts, because each community, while they might only be separated by a couple miles, has very specific cultural practices. And so those are things that you don't think about, right? Not to also mention the challenge of educating women in a role where they're typically not seen as leaders in their community, are now advancing into the different hierarchy within their communities. One of our promotoras even went on to become a community president, which was the very first female community president for her community.
That is absolutely wonderful. I am sure Sacred Valley Health is transforming this community and changing the lives of these women and these children. Keri, thank you so much for sharing your project with us. And we look forward to hearing more about the project through your reports. Good luck.
Thank you so much. And thank you for this opportunity. And thank you so much, Dining for Women.
You're welcome.